So let's talk about facial rejuvenation and facial surgery. For the treatment of facial aging, there are a variety of procedures that are available, from Botox and fillers, to lasers and chemical peels, to surgery. Botox and fillers are discussed elsewhere and are generally used to improve wrinkles and deep lines temporarily. These are quick procedures that essentially have no downtime or recovery, and results are visible within a few days, if not immediately. Lasers and chemical peels are generally used to treat the skin's surface, especially fine wrinkles, age spots, or skin pigmentation. Lasers and chemical peels do not significantly treat sagging skin or fat atrophy in the face and neck. There is minimal skin tightening as compared to surgery. The procedure is typically done only with topical anesthesia or local anesthesia, or possibly mild sedation. There is typically some recovery, which can last from a few days to weeks or even months, depending on how deep the laser or the peel goes. Laser procedures can be risky and cause severe complications if not done by someone with experience. Do not assume that just because it's a laser, it is precise and cannot harm you. Possible complications include severe burns and loss of pigmentation. Generally speaking, the deeper the laser or the chemical peel goes in your skin, the more the wrinkles will be treated, but the higher the rate of complications. Now, facial surgery is used to elevate skin and fat to a more youthful position, to tighten the skin that has sagged and loosened, and to remove the excess skin. The muscle layers, which also loosen and sag beneath the skin, can also be tightened. The procedure is usually done with either fairly deep sedation or general anesthesia. The recovery period is usually at least 2 weeks. If the procedure is done well, it should not be obvious to a stranger that the person had surgery. It should be natural. The over-pulled look or the wind tunnel look that we sometimes see is typically from poorly done surgery. The goal is for a natural yet more youthful appearance, and this can usually be achieved with the right technique and a skilled surgeon. It is important to realize that one doctor's facelift is not the same as another's. A procedure like the lifestyle lift that takes one surgeon, who's usually not a plastic surgeon, 1 to 2 hours and is done under local anesthesia is not the same thing as a facelift that takes an experienced plastic surgeon 3 to 5 hours and is done under general anesthesia. There are many variables when doing a facelift, from where the scars will be to how the tissue is tightened, that make a huge difference in the final result. You should not shop for facelifts by price. If you are paying for a Toyota but expect a Rolls-Royce, you are going to be disappointed. You should realize that it is usually impossible to undo the damage from a poorly done facelift. Remember, there is no way to hide your face unless you never leave your house. My suggestion is that you not take chances and be tempted by a price that is too good to be true. Select your surgeon carefully and make sure you ask the right questions. Best of luck to you.